I'm Dr. Norman Shealy. I am the CEO of the International Institute of Holistic Medicine and the founder of the American Holistic Medical Association. For the last 45 years, I've had the pleasure of working with a number of talented spiritual healers, starting actually with Olga Worrell, the most studied healer in history. Since that time, I've done a total of 200 different patients with a variety of healers, perhaps 6 altogether. The most interesting thing to me about spiritual healing from a physical point of view is they can change the electroencephalogram from a distance of up to 1,000 miles within seconds. So my standard test, other than looking at the possibility of healing, is to see whether the healer can affect the EEG from some distance. It doesn't seem to make any difference whether they're outside the room or miles away. This week, I've had the pleasure of working with Kimberly Meredith. She is the most unusual of all of these healers. She does much more hands-on work, both in making a diagnosis, and she is very accurate at picking up exactly where there is pathology and or symptomatology. Today, in addition to working with the final 18th patient that we have worked with together, I asked her to do an EEG on one of the patients. So the patient is in a room with the computerized EEG hooked up. The patient lies there for 12 minutes for a baseline of what's going on in her brain in deep relaxation. And then for the next 12 minutes, Kimberly, outside the room, maybe 15 feet away at the most, but through the wall, is sending healing. The EEG on this woman, when she was at rest, was in delta, deep relaxation, 1 to 3 cycles per second, and fairly strong. Interestingly, during the 12 minutes that Kimberly was sending healing, the brain just became quiet. The delta disappeared. There was no other frequency there. One tiny little spot in the back part of the brain on the right, as if she was just on the verge of going to sleep. But the difference was quite striking. There's no question it changed abruptly. And to me, this shows that Kimberly is, among other things, almost certainly focusing scalar energy. I don't know anything else that could travel through a wall and that fast except scalar energy. But it doesn't matter. What matters is this proves she is having a physiological change on the patient. Can she sit up?
Yeah. Okay.
Go sit up. I want you to see it.
Okay, yeah, I can see this.
Look here. Baseline shows very, very deep delta.
That's the red.
The red. It's deeply relaxed. That says she's not thinking, she's not, ruminating, she's relaxed.
Right.
But during treatment,
Yeah.
it goes really quiet except for her right occipital area.
Oh, really?
Yeah.
And what is that area, sir?
Well, that's the visual center of the brain, but that's as dramatic as you'll ever get. It's as if she's creating some kind of imagery maybe in the back part of the brain. I mean, she may not be aware of it. But I mean, you see, obviously this is a big change.
So when Kimberly was sending the energy, that part was activated. But that's pretty amazing, right?
That is as good as a change as you'll ever see.